Today we are doing Agnes, and Agnes is microneedling with radio frequency, and we are treating her jowls right now. And this is such a popular treatment to kill fat. It's one of the few treatments that we could really do a targeted fat removal. So the way this works is that I did some lidocaine into her skin. So hopefully she doesn't feel this super much. Is that even a word, super much? Anyway, we did lidocaine so she could tolerate this. And then there's 3 little baby needles right there. They are 4 millimeters long, and we are piercing the skin to get to the fat pad down there. And then when I push the button with my foot, the pedal, it releases radio frequency, which kills the fat. So it's a really great treatment for areas such as jowls. We treat fat pads under the eyes. If there's an area, like if you did liposuction and then there's a spot that has a little collection of fat that they couldn't get, we can do it with Agnes. Another great treatment for Agnes is treating sebaceous glands. So for acne, it's a wonderful treatment. If you had lipomas, you don't actually have to have those surgically removed anymore. So I usually recommend 2 treatments of this, spaced 3 to 4 months apart. For eye bags, it can be as many as 4 treatments. It could be more than that too, but that's typically, we like to do about 4 treatments for eye bags because those are little stubborn suckers. And then everybody is a candidate for this unless you have metal where we're treating. So if she had a metal jaw implant, we would not be able to do Agnes. Of course, defibrillators, pacemakers, we can't do really anything on patients with those. But if you do have cavities that were filled a long time ago, that's actually okay with Agnes. Some people worry about fillings, so you don't need to worry about fillings. So every skin type is a candidate. You can do it in the summer. It's a great summertime treatment. And then we, as a aftercare, she might have some bruising because they are little baby needles that are going in. And she could have some swelling for up to a week. So that's a typical jowl treatment. And then we'll do some tightening of the jowls as well.